Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation.
Coming up, we will be on location at Potomac Falls Family Dentistry in Potomac Falls, Virginia, discussing the latest advances in dentistry and how they can give you the healthy and beautiful smile that you've always desired with one of this area's leading dentists, Dr. Jalan Abdulrazik. Dr. Abdulrazik received her advanced general dentistry residency from the University of Maryland's Dental School in Baltimore, Maryland. She is a member of the American Academy of Cosmetic Dentistry and is recognized as one of this country's top dentists by the Consumers Research Council of America. Welcome, Dr. Abdulrazik.
Thank you, Rocco.
Oh, it's our pleasure to have you on your first time. In fact, on our program, we have a lot to talk about. I understand there's going to be some patients joining us a bit later as well. So let me begin by asking you, Doctor, if you can please tell us what are some of these latest advances in dentistry?
Well, let me tell you, Rocco, I cannot be more excited about anything right now as I'm excited about practicing dentistry nowadays. There's so many things that are going on that we can help our patients with. There's implant dentistry, we have Invisalign, there's periodontal therapy, endodontic therapy, cosmetic dentistry. There's so many things that we can do, but if I'm to choose one, the one thing that excites me the most is laser dentistry.
Oh, that's interesting. Please tell us about that.
Well, I think laser dentistry is a new standard in dentistry. We utilize three types of lasers in our office nowadays. One is a soft tissue laser, it's called the EasyLase. And with this one, you can help a lot in the healing after surgeries. You can do a wide variety of like soft tissue procedures. And also we have the MD Waterlase. This is a hard soft tissue laser. This is the one that I'm going to be talking mostly about today. The third laser is a cavity detector laser. And this one shines inside the tooth and it tells us how much decay is in it. And it helps a lot in having like a more conservative, less invasive dentistry.
So basically the advancements in technology through laser dentistry really are revolutionizing what a dentist can do now as far as diagnosing problems, fixing problems within one's mouth.
Most definitely.
And in fact, I was going to ask you that, Dr. Abdulrazik, just so we have an idea what type of dental problems can be corrected through laser dentistry.
You can do a wide variety of dental procedures with the lasers. You can clean cavities with it and remove old composites. You can do a lot of surgeries with that, like frenectomies, tongue ties with, in cases of speech impediment, crown lengthenings, gum contouring. It's wonderful in treating periodontal disease. You can get in there and gain, attachment, without laying even a flap or stitches. And it's also helpful in removal of pigmentation in people with hyperpigmentation in their gums. Even laser-assisted extractions. And the wonderful thing about it, all that is done without laying a flap, stitches, minimal discomfort, no bleeding. It's amazing.
And how long would you say the treatments typically would take? And I'm sure, Dr. Abdulrazik, it varies based on how much work is being done on each particular patient, but just in general, does it speed it up a little bit? It makes it more efficient, the whole process?
Well, it depends upon the procedure, but laser dentistry cuts on the treatment time tremendously. Procedures that we used to do in several appointments, like having crown lengthenings or soft tissue recontouring or root canals in conjunction with restorative dentistry, we had to wait for a good 4 to 6 weeks for healing, before we can go ahead and finalize our restoration. Right now with the laser, I can get in there, I do my surgery, do the crown prep, finish everything, and the next time is just delivery. So it's way easier for the patient and don't have to deal with staying in temporary crowns. And overall, it's very, very pleasant for the patient.
Well, certainly happy to hear that. And I was going to ask you, what type of results can we expect from laser dentistry, doctor?
We can definitely expect from lasers that it heals with much easier, with easier recovery time and less discomfort. Most of the time we can do a lot of restorations without even having anesthesia. And this is very impressive. It's much comfortable for the patient.
I believe you have some patient before and after pictures that you'd like to show us?
Yes, I do.
Let's take a look.
This is a 16-year-old that had crowding deep overbite. This is how his teeth look like after Invisalign. And great setting, but notice here we have some uneven gum line and too much of his lower teeth covered by his gum tissue. This is immediately after gum recontouring, and this is a week after. Notice how healing gums look like after only 1 week. This is a case of teeth decay at gum margin. Notice how conservative the cavity preparation is, and this is after it was filled. Another occlusal cavity, very conservative. See, that's how it looks after the filling. Another case of crown lengthening. See how clean lasers cut, no bleeding, no stitches. And this is a case of depigmentation. Notice the dark pigmentation of the gums. And this is a 6-month after picture. Gums much lighter. And this is a case of frenectomy. See how the frenum is spreading those two incisors apart. And this is a week postoperative. Again, no stitches, no bleeding. This is a herpetic lesion 5 days after treating it with the laser. Completely healed up.
Very impressive results, Dr. Abdelrazek, from what we just saw, and very natural as well.
Yeah, definitely. It's way more comfortable for the patient.
Who would you say is a typical candidate for the laser dentistry treatment options that you've discussed here today?
When it comes to laser dentistry, literally everybody's a candidate for laser dentistry. It's especially useful also for patients that are fearful of dental work, that are apprehensive about having their dental treatment and having anesthesia. People that don't like the sound of the drill. And basically people who want to have more comfortable treatment, less invasive dentistry, and better results.
We're now going to meet two patients of Dr. Abdelrazek. Welcome, Julie.
Thank you for having me.
Oh, it's our pleasure. We always appreciate it when patients take time in their busy lives and schedules to come down and share their experiences for a few moments with us. And on that note, I'd like to ask you, Julie, what dental problems were you experiencing prior to coming to Dr. Abdelrazek?
I met her in 2006 when I was looking for a new dentist to help take care of some problems that I'd had with my teeth from when I was younger from an injury. That left me with teeth that I wanted to repair with crowns and some aesthetic properties to it, along with other dental work that I needed to have done that had been left uncared for a while.
So then you came to Dr. Abdelrazek, and what exactly was involved and entailed? And
a good overall look at the care and the health of my mouth over the years, what could be done to repair my front teeth. She crowned my front teeth for me and gave me a new smile. I was very happy for that, and then also really helped me get my dental work in line. Just what needed to be caught up with, and a nice comfortable environment on my time schedule. I was able to get everything done over a year's period, and really feel good about my teeth afterwards and my dental care.
So I take it from what you just told us, you're very happy with the results.
Yes, very happy. People say that I have a better smile. It's like very subtle but slight difference in my smile that they can tell. So.
And the confidence, I take it, is back too.
Yeah, I'd waited a while, but it was definitely worth the wait to run in and meet Dr. Abdelrazek and get my work done on my teeth. It was well worth the wait, and very happy with the results.
Well, on that note, I'd like to thank you, Julie, for joining us and being a guest.
Thank you. Thanks so much for having me.
Welcome, Kevin.
Thank you.
Oh, it's our pleasure to have you on as well today. And I wanted to begin by asking you the same thing I asked Julie a few moments back, and that is, what dental problem or problems were you experiencing prior to coming to Dr. Abdelrazek?
Actually, many years of neglect of my actual dental health. So went as a adolescent. I had my front two teeth knocked out, and some early dental work done on that, and a fear of dentistry actually kept me away from maintaining my mouth in general. And it was a lot of actual problems, a lot of decay, a lot of visual problems, series of teeth, bridges missing. I had teeth removed instead of actually where I wasn't taking care of it. So there was actually quite a laundry list of activities that we finally found someone that we could trust and work with.
What happened next?
She actually laid out a wonderful plan on where I was and where we could go, and there was a number of items that that had to occur in the right order. For instance, as I went through and got more or crowns put on, my teeth that weren't getting any work, needed whitening so they could match the work being done. So we scheduled things out. Sure. One of the other things that I'm sure affects a lot of people is the cost structure, and we were able to structure it over years. So we had flexible spending accounts that I was actually making sure that I was utilizing my health care to the maximum, utilizing other structures, and started some working through, and really I would say it's about a 3 or 4 year total program between all the bridges, all the crowns, the whitening, and everything.
Well, I can tell you certainly seem very happy with the results from what I'm seeing.
Yeah, very much so. Self-confidence comes from many things, but over many, many years, I learned not to smile, right? Or when you're laughing out loud, to cover your mouth when you're laughing, right? Because of the discoloration, etc. So it's been, I think, 7 years now of learning that it's okay now to smile, etc. That visually it's you're not repulsive,
yes.
Though it wasn't that bad. You felt that, right? So
yes. I'm so happy to hear that, and I'm very pleased that you're very pleased, and obviously Dr. Abdelrazek, like she's done with all the other patients, did a wonderful job with you, and in your case, a customized program which worked within your budget as well as the needs that you had, and over a period of time and very effectively. Obviously the results speak for themselves.
Thank you.
And I'm very pleased to have you on and share that experience with us, because what you said a few moments ago, a lot of people can relate to. So thank you, Kevin, for being a guest on our program.
Thank you.
We're now back with Dr. Abdelrazek. Are there any age restrictions, would you say, doctor, as far as who could gain, the benefits of laser dentistry?
Absolutely not. It's even, very useful for kids who have several cavities, and it's even safe for pregnant women.
Now, are the results permanent that you've discussed here this afternoon?
Well, when we're talking about permanency, no, nothing is permanent. But if we're talking about something like surgical, like a frenectomy or a lesion removal or any type of surgery, of course it's permanent. What's done is done. But when we're talking about restorative treatment, like fillings or porcelain restorations or any of those, it has the life expectancy of a well-done restorative treatment.
And that would be, what would you guesstimate, 10, 15 plus years or more?
Yeah, in a filling around 5-10 years, and with porcelain restorations about 10-15 years.
Very impressive. Now, we've only got a few moments left, doctor, and I wanted to ask you, from our research, obviously we found that you have a very good reputation, good amounts of experience, very well qualified, obviously, as far as being one of the area's top dentists. And I wanted to ask you, what sets you and your practice apart from many of the others?
I'm very passionate about dentistry, Rocco. I grew up in a family of dentists. Both my parents are dentists. My brother became a dentist, and I always knew that I wanted to be one. This is what drives me. I truly believe that our dentistry changed people's lives every day. And I also know that our patients come with their own set of priorities and needs. And we listen to them, and we know what they want and what's important to them. We give them the best treatment option, in our opinion, and then we give them to choose the best treatment for themselves.
You really care about your patients. You certainly do, and we found that out as well.
Yeah, we love our patients. We always try to keep on top of the cutting edge of dentistry. We take a lot of continuing education courses to keep up with all the new advances in dentistry. And so we can also give our patients all the different types of dentistry in the same place without having to go to different places.
That's certainly very impressive and good to hear, Dr. Abdulrazik. And on that note, I'd like to thank you for joining us and being a guest on our program. Certainly very helpful and insightful indeed.
Thank you for having me on.